Hello, I'm Justin Suyas with Henry Schein Dental. Digital dentistry is one of the largest growing segments of the dental industry, and I'm excited to have you hear a few words from some of our users about the amazing experiences they've had with 3Shape and the TRIOS system.
January 1st of this year, we started working with the TRIOS camera system, and it incorporated incredibly quick into the office to the point where within a week it was standard for us to use and very easy for us, and we couldn't go without it right now.
The actual learning curve with scanning itself was almost zero. It's just a very intuitive, easy to use scanning system.
We can do things faster, we can do things quicker, we can do things cheaper, and the communication during all that is unprecedented in what we've ever done.
The TRIOS accuracies basically eliminated remakes in our laboratory and allows us to feel confident that every case is going to fit contacts, occlusions, and color now.
My hygienists are amazed by the way the 3Shape crowns fit. What they tell me is they can't feel a transition between tooth and crown.
The HD camera in the TRIOS system allows excellent custom shade representation right from the very beginning, and the laboratory technician has no questions how things should look.
The color of the teeth, I've got the tissue, I've got everything, so it's like working on a patient for me.
We feel that if they take a scan with the color now, they will not have to send the patient in for a color match.
I, as a dental technician, doubted the the digital world, but I am so wrong. It has been amazing. The way the crowns fit and the way the partials fit. Crown seat appointments are 10 minutes. And it takes longer to remove the cement than it does to try everything in, and there's relatively no adjustments.
With an intraoral scan, I get the models, a 3D model, to do restorative work or diagnostic work. I can take shades, I can look at tissues, because with a lot of the implant cases today, we're replacing tissue also. So I can see tissue, I can see teeth, I can see translucency, and all of this is on my screen while I'm designing. So it's like I'm working directly on the patient. So to have all that information in a laboratory just joins me with the doctor and patient so much closer.
So there's the response to no impression, 2, there's the ability to correct something, and then 3, there is the greatly enhanced accuracy of using a digital system to make a dental restoration.
It would be a nightmare to go back to analog because of the fits, the ease, the speed of this system. Also, having a digital model available to call up at any time versus taking an alginate because you're afraid of undercuts or pulling out teeth, not using PVS, you got one pour. PVS, it can distort. When you ship it to your laboratory in a cold truck or a hot truck, it can distort. There's a lot of room for error. You don't have that with TRIOS. You don't have that with 3Shape. It's fantastic.
The return on investment of digital is so amazing, and it's really, the payoff is so fast. And that is just considering savings on impression material, but there's also reduced chair time, increased accuracy, but what no one ever talks about is the patient response.
A lot of patients for crown and bridge choked, gagged, were afraid of the impressioning. They feared impressioning more than they feared a shot or the procedure.
They're excited about how the final product looks, feels, and the decreased amount of chair time is very much a big plus.
So my patients love it and end up referring people, friends of theirs, people in their family that they might not have ordinarily done because they become really enthusiastic about digital dentistry as well.
And our results have never been better, and our communication is ultimate at this time because we communicate in 3D, not just over the phone.
We're able to communicate and show doctors the restorations before we even mill them.
And I can go on my phone with 3Shape Communicate and see one of the cases he's got a question about.
I can see at what stage my crown is being fabricated on. I can comment on anatomy. I can comment on contour.
Wherever I go in the world, I am always connected to dentistry through digital.
The most important thing is with larger cases, which sometimes would take 8 to 10 visits, we can decrease that to 2 or 3 visits at the most. And at the time of delivery, rather than potentially half an hour per unit, it's decreased that by maybe 3-fold.
It's a wonderful way to work.
We at Henry Schein Dental are very excited to help integrate digital dentistry into your practice. Please feel free to give us a call or go online at henryscheindental.com to schedule a demonstration.